Where am I coming across?
You've been called to the scene of a jumper down.
Jumper down. I have my standard precautions on. Is the scene safe?
The scene is safe.
How many patients do I have?
You have one patient.
The mechanism of injury is?
Victim has fallen from at least 2 stories.
Oh, okay. My general impression of a male, approximately 30 years old, lying supine on the floor, appears to be unconscious at this time. Right. I'd like to do standard C-spine precaution. Am I going to do that? The same responsiveness. Sir, can you hear me?
No response.
Does he have a carotid pulse?
He does.
He does, okay. I do a modified jaw thrust to see if his airway is open, clear, and maintained.
Okay, your partner does.
I'll check inside the mouth for any type of obstructions. Do I see anything in the mouth?
No.
No, okay. Do I hear clear airways or snoring respirations?
Airway snoring
All
respirations.
right. Does he try for OPA? Does he accept an OPA?
He does not. Yeah,
Does
exotic.
accept an OPA. Okay. At this time, I'm just going to put a non-rebreather on his face
Okay.
to continue oxygen administration. All right. I'm going to open his shirt.
Okay, you expose his shirt and you see paradoxical movement on the right side of his chest.
All right. Going to palpate on that side.
Okay, it's pain on palpation.
Pain and palpation. Okay. I'm going to put a bulky dressing on that to stabilize that area.
Okay.
Okay. I'll listen to lung sounds in 2 places at the apices. I hear clear lung sounds
They're clear, but they're diminished on the right side.
on the right side. Okay. Good. I'm going to check for any type of bleeding. Ready as oxygen. He does not accept an OPA, so I'll keep him with the non-rebreather this time.
Okay.
Checking for bleeding under the head and neck. Do I see it?
Nope. I'll tell you if you find something.
Okay. Small in the back. Nothing. Under the arms. Go down to the knees. And the ankles.
Okay, after checking the voids, you found no sign of serious bleeding.
Great. The skin temperature color are? He's warm, pink, and dry.
He's pale, cool, and sweaty.
And checking for distal pulses. He has
Okay.
distal pulses?
Yes.
He's in shock. I feel my patient is at this time a rapid trauma transport. Okay. I'm going to notify the paramedics that are coming that I have a male who's semi-unconscious on O2, had a fall, and at this time no obviously bleeding, does have a flail segment on the right side. Okay. I'm going to go proceed now with my rapid assessment. No crepitus, checking for crepitus, back of the neck,
No deformity, no swelling, no tenderness.
look for JVD, tracheal deviation, if there isn't any.
There isn't any?
All right, I'm going to apply a cervical collar at this time, checking for more crepitus on the chest. Is that status still the same?
Yep.
Okay, more lung sounds, this time in 4 places. I still hear rather normal sounds.
Yep, just diminished on the right side still.
Okay. Abdomen,
Abdomen's rigid to the touch.
rigid to the touch. Okay, I'll note that right now. Pelvic,
Stable.
stable. Go down both arms. Any deformities?
Nope. Okay, both deformity to both lower legs.
All right, I'm going to open up the pants, cut the pants open, and see what I see.
Okay. All right, you see no bleeding, you see closed
Closed
fractures.
fractures, but I'll deal with that when I get later on. Yeah.
Okay.
I'm going to roll the patient out to my side. On the count of 3, with help.
Count 1, 2, 3.
Okay. I'm going to look at the back, feel the back, the spine, buttocks.
All clear.
All clear. On the count of 3.
1, 2, 3.
Good. I'm going to put him on the backboard, secure him to the backboard, and get him to the ambulance.
Okay, you are now in the ambulance.
Palpate the head, eyes, look for any raccoon's eyes, battle signs. I'm going to get my flash, my pen light. I'm going to check both eyes, see if they're equal reactive. Look in the mouth, look in the nose for any types of fluids, blood or CSF fluid. I'm going to go down to the neck. Collar for any JVD or tracheal deviation.
None.
None. Down the clavicles to the chest, on both sides of the chest. You can look for equal expansion. I'm going to check the lung sounds in 6 places. Does this sound clear?
Okay.
Okay. Abdomen, checking 4 places. Alright. Check down each arm. Check for a pulse. Down each arm. Check for a pulse. If he's awake, I would do PMS. Go down to the pelvic region, in and down. For crepitus, if I suspected a genital trauma, I would check that too.
Okay. No trauma, no priapism.
Down each leg for a pulse. Check for a pulse. All right. If he was awake, I would do PMS as well. At this time, I will do a blood pressure, full set of vitals. I get 88 in regular.
Okay, for the scenario, his pulse is 100 regular.
And his respirations this time is 20 and non-labored.
Okay, respirations are 28 unlabored.
Non-labored or labored?
I'm sorry, labored.
Labored? Okay. Will he accept the OPA at this time?
He still does not accept the OPA.
Okay, I'll leave him on the non-rebreather then. At this time, I will check secondary wounds and take care of them. I will notify the hospital that we're coming in with a 30-year-old male who had a fall, unconscious, possible head injury at this time with a flail segment on his right side of his chest. And vitals are 150 over
160 over 100.
160 over 100. Pulse is
100.
100. And respirations are 28 and non-labored. Okay. I would check his vital signs every 5 minutes because he's a rapid transport patient.